and thank you all for joining us this morning. I was hoping to make an announcement this morning about our application to move to phase 2, but we have not yet heard from the Department of Health. We understand their recommendations have been delivered to the governor. We do expect to hear today, a little bit later on, and we'll let everybody know just as soon as we get the word. I know everybody's impatient, as I am. Every day matters for our businesses and workers, small business owners, families. As soon as we know something, we'll be letting you know, getting the word out far and wide. If we are approved to move to phase 2, which I'm very hopeful that we will be, we must all still continue to follow the key health guidance that we've been talking about, practicing social distancing, wearing face covering, public, keep washing your hands, and we really need to keep those protective measures in place to keep the curve flat and low. So we'll be emphasizing that message. So with that, I have nothing else. With that, I'll hand it over to Dr. Spitters from the Snohomish Health District.
Thank you, Executive Summers, and good morning, everyone. So while we're anxiously awaiting a decision on our variance request to move to phase 2, I'd like to focus on 3 items briefly this morning. First, the health district's next steps on making testing available to add on to the existing testing capacity available through the clinical services in the county. A couple of mentions about some general trends on recent data, and reminders about new guidelines. So first, with regard to testing in the community, with the CARES Act funding, we are significantly expanding testing operations this month and anticipate continuing to do so through the summer. Remembering that testing is a key component of those suppression efforts as we begin to try to open up society, have more contact, that increases the risk of transmission. And so we want to, even more than before, be able to identify cases, quickly isolate them, and get their contacts notified and quarantined as well. So the team is finalizing plans now, and we hope to have more details out by Monday to share with you. We will be moving to a stationary site for much of June, similar to the operations at Memorial Stadium that occurred earlier in the year. There will be some evening and weekend options, and it will be a location close to transit. So between that combination of features, hopefully we can make it accessible to anyone who needs it. Testing will continue to be available for anyone reporting symptoms of COVID-19, for example, fever, cough, difficulty breathing, sore throat, body aches, or loss of taste or smell. And again, I want to influence anyone that has symptoms like that right now should be seeking testing through their personal health care provider, an urgent care clinic, or through one of the health district testing sites. This includes, but is not limited to, those over age 60, individuals who have underlying health conditions that make them more likely to have a severe case or need hospitalization, as well as people with compromised immune systems. Also eligible for testing are people without symptoms who are close contacts of a recent confirmed case, those who live in a congregate setting, group settings like homeless shelters, long-term care facilities, group homes, etc., or who work in a location that has had an outbreak, meaning 2 or more cases connected in space and time over less than 2 weeks. Going forward, we're also looking to include other asymptomatic individuals that are at higher risk or who work in jobs where outbreaks may be occurring at their workplace would be of particular concern. Examples would be healthcare, first responders, and others who work in close quarters or work with vulnerable populations. So again, please look for more details on health district testing sites coming in June, early next week. We should have that posted for you. And we'll mention it again on the Tuesday briefing. Brief mention of data. Those of you who see our daily counts see a somewhat bumpy but continued gradual decline in reported cases that continues, and now we've had 3 of the last 7 days with case reports just down in the single digits. So all good news there. As well as new long-term care outbreaks seem to be winding down in number, and we're only seeing 1 or 2 or even less per week now. Going forward, we're planning on more involvement with workplace-associated outbreaks, which, as I alluded to earlier, seem likely to pick up as economic activity begins to resume. New guidelines. I highlighted this on Tuesday, but again, I think it merits repeating. Beginning next Monday, June 8th, all employees in their work settings in the state of Washington are required by the governor to required by the governor to wear a cloth facial covering, and the health district endorses that requirement. Exceptions are when someone's working alone in an office, vehicle, or at a job site where they have no contact with other people. And then if they come out of their office and go elsewhere in the building or have a meeting, they should remain distanced physically at least 6 feet from everyone else and don a cloth face covering in that moment. Employers must provide cloth facial coverings to employees unless safety and health rules and guidance from the Department of Labor and Industries indicate that their exposure dictates a higher level of protection. So, for instance, a healthcare worker, instead of a cloth face covering, needs to have on a surgical mask or even a higher efficiency filtering face mask. Employees may choose to wear their own cloth facial coverings at work, provided it meets the minimum requirements set forth in the governor's direction. Employers also must post signage at the place of business, strongly encouraging customers to wear cloth facial coverings. Businesses are not required to exclude patrons who decline to wear a cloth face covering, but they're certainly free to do so, and I don't think that's a bad idea in the interest of protecting the staff as well as other patrons. So with that, I'd like to turn it over to Brian Nielsen with Washington State Department of Transportation to share a few updates from his end.
Morning. Thank you, Executive Summers and Dr. Spitters, for having me here with you today. I'm Brian Nielsen, the Deputy Regional Administrator for the Washington State Department of Transportation. I'm responsible for maintenance, traffic operations, engineering, design, and construction for state highways, including I-5 in Snohomish County. I intend to address a couple of topics with you today that will interest folks who live, work, and travel in the area. The first is summer construction and how we are implementing new measures to ensure crew safety and reduce the risk of spreading COVID-19. With Snohomish County's Phase 2 variants under consideration by the Department of Health, there are additional activities that could move forward soon. The second is work zone safety. With construction and maintenance crews working on the road, we need help from each of you to ensure everyone gets home safely at the end of the day. And we'll open to questions after that. So summer is our busy season for construction. Our efforts largely focus on preservation of our existing highways so they can continue to be reliable for commuters and freight haulers. We also have a significant amount of work to remove barriers for migratory fish and improve habitat underneath the highways this summer. Additionally, there are safety enhancements that are planned in various locations. As with anything WashDOT does, our priority is safety for all involved. As provided under Washington Safe Start Phase 1, there are low-risk activities already underway with specific COVID-19 health and safety plans in place. These plans require control measures such as screening workers for signs and symptoms of COVID before they enter the job site, maintaining 6 feet of separation between people on site, the use of proper personal protective equipment, face coverings, gloves, and eye protection, and sanitizing and hygiene practices. We wipe down common touch areas and provide hand washing stations for our crews. If Snohomish County's variance is approved, that would allow Phase 2 activities on construction sites. For our work, the biggest difference from Phase 1 to Phase 2 is that Phase 2 activities can be performed where it isn't possible to maintain the 6 feet of distancing between workers. In those cases, more robust face coverings will be used. Touch on some projects in the area that people will expect to see this summer, starting with US 2. We will continue the paving on US 2 between Bickford Avenue and Gold Bar. This work began last year and should be completed this summer. Also between Bickford Avenue and the SR9 interchange, a new median barrier will be installed. Further east on US 2, our contractor will rehabilitate bridge decks on US 2 between Gold Bar and Snohomish to extend the life of those bridges. We began work on that project last month under phase 1, and we will continue when the phase 2 variance is approved. On SR9 in Arlington, our contractor will complete the installation of a new single-lane roundabout on 108th Avenue Northeast in Marysville. That work should start later this month or in early July. And we're also working on SR 530 east of Arlington to remove fish barriers and restore natural habitat. Roadwork by our contractors and our maintenance crews are vital to keeping goods and people moving in our state. We need your help to ensure everyone in our work zones and those traveling through can go home safely. Employees in work zones are husbands, fathers, brothers, wives, mothers, sisters, children, and friends. They all deserve to go home safe at the end of their shift. Since 1950, 60 washed out employees have been killed on the job. They leave behind families, friends, and coworkers who are never the same. If you need to get behind the wheel, please make sure your full attention is on the road and you're capable of operating a vehicle safely. That means free of distractions like using a cell phone or other devices, not driving under the influence of drugs or alcohol or fatigued by lack of rest. And when driving, be on the lookout for orange construction markers and reduce your speed as indicated by signs and flankers. We're counting on you to keep our workers safe this summer. With that, I will open for questions.
Great. Thank you, Brian. I think the first question really is for Dr. Spitters. The question is, there have been several large protests in the county in the last few days. How concerned are you about these leading to a spike in cases, and what is your message to those who choose to take part in protests in the county?
Well, certainly the potential for transmission to occur in a large gathering like that is there. And we've seen no signal of that as of this time. It might be a little bit early to know, because if you think that the average time to getting ill after being exposed is 4 to 6 days, it can be as long as 2 weeks. And then it's usually another day or two to get tested, and then for us to learn about the positive results. So the minimum amount of time after any gathering that we would expect to see any detectable increase in cases would be a week, given that at least from what I'm seeing, the attendees tend to be on the younger end of the age spectrum, but not exclusively so, but it's largely a younger population. It's possible that if there was an increase in cases and they had mild illness and didn't seek testing, it could be another generation of cases another week or two down the line. So in sum, it could take anywhere from a minimum of 1 week to 3 weeks or so to see if there's any increase in transmission associated with these gatherings. Nevertheless, I think the key message is for those of you who are going out to protest is to be safe, wear a cloth face covering to protect those around you. The others wearing cloth face coverings will protect you. Carry hand sanitizer, and to the extent possible, try to avoid direct physical contact, and certainly keep a space buffer between you and other people who are out there with you, and follow all the other prevention guidance that we've been setting out before.
The second question is directed at me. If the governor does grant phase 2 today, what is the start date for the county? And what is the county going to do to ensure compliance beyond having people report non-compliance? So we are hoping and assuming that the effect of the green light to go into phase 2 will begin immediately. We don't have verification of that from the state, but that's my assumption. That's been the case in other counties where the state has given the green light to move into the next phase. So very hopeful that we'll be essentially starting tomorrow. That's my hope. If it's any different, we will let you know as soon as we hear from the governor's office. In terms of enforcement, again, we will hopefully have people report businesses that are not complying. We'll look at all the tools we have available. I was in error at our last gathering. The county for some time had stopped business licensing, but we do issue some business licenses. So withdrawing business licenses is one option. If it's a restaurant or food business, the health district has some tools at its that it can use to allow businesses to continue or not. Clear up to action by the state attorney general, as we saw in Snohomish. So we'll look at the nature of the offense and try to do something that's proportionate. But at the end of the day, really to be successful, we have limited capacity to enforce. We're going to be really relying on people to really support those businesses that are doing the right thing and trying to protect your health. And if they clearly are not and are violating the rules, we ask you not to frequent them, do not support those businesses. This is important to us all. It's important not only for our economy, but for our public health. So we're going to ask our residents really to self-enforce as much as possible. So, and next question is for Dr. Spitters. As we move in phase 2, what does the health department think will happen to COVID spread and new cases?
Well, none of us have been here before, and we're out at the leading edge for the country. So I think, we look to those successful models from around the world that have tried to reopen society, and those that seem to have done it successfully do a lot of testing and have rigorous contact notification and quarantine efforts. And so certainly, as I said earlier, as more activity means more people coming in contact with one another. So the potential for transmission to lead to more cases is most certainly going to be there. And our goal at the public health department end is to make sure that testing is widely available and that we have people understanding you have any symptoms, go get tested. And then we do our part to notify people with positive results of their need to stay home and then we identify their contacts, talk to them about staying home. And so that's the goal. More human activity, more human contact, but we'll try to control transmission. And then for all of you out there, the general community, is to continue to do everything you can to reduce your chance of acquiring or spreading. Wear a face covering when in public, wash your hands frequently, certainly before eating, when you get home, and then carry hand sanitizer with you and have it readily available in your workplace. Use that a lot and stay 6 feet or more away from everybody as much as possible.
The next question is, in previous weeks, we've seen counties get approved for phase 2 within a day of submitting an application. What do you think has slowed the application process for Snohomish County? And I'll start and then turn it over to you, Dr. Spitters. We got new criteria and a new application process on Sunday afternoon. Turned the application around. We had been preparing, the health district and my Department of Emergency Management and others have been preparing an application all through last week and before. So we had to reformat. It was submitted at the end of the day on Monday. I was hopeful we'd get a quick turnaround also, but in retrospect, we're 4 days later. It seems like a month, but it's 4 days. And I do know that apparently there's 6 counties total applying to go into phase 2, and there's a number of counties applying to go into phase 3. So I suspect there's several factors, just more counties in the pipeline looking to move on to the next phase. The application process is a little bit new, and also we're larger counties now that the state is having to look at in total. I know King County is looking at a partial phase 1B, if you will. We're looking at full phase 2. I know some counties to the north also applied. And so I think it's just the complexity of the application, the number of counties, and just where we are. So Dr. Spitters, you may have more specific information.
Executive Summers, I don't have anything to add. I think it's just, as you mentioned, in the Department of Health and the governor's office trying to do their due diligence to look over all those applications that are coming in, give them a fair assessment, and then get back to us. And we're anxiously awaiting.
This is Carrie in the Joint Information Center. Oh, there we go. We have another question. I was going to say we'll give it a minute. So
Can you expand on at all on where the new testing site may be, Dr. Spitters?
Well, that the planning activity for that is delegated. It'll be somewhere, in I-5 or State Route 99 corridor that's accessible by public transportation. Likely to be closer to the more urban core of the county for sustainability, and we'll have more information for you next week.
this is Carrie again. I'd like to give it a minute or two more just to make sure if someone's still typing their question in that we don't miss it. And then in a couple of minutes, if we don't see additional questions, we will go ahead and wrap up. So we are still not seeing any other questions. I know minutes feel extremely long when it's silent on Zoom.
Gary, just got a phone message that we've been approved for phase 2.
Whoa, how's that for timing?
And I accidentally just hung up on my director of emergency management.
Okay, so it sounds like we have some news on that. I don't know how many details we have. We're close to wrapping up here. I don't know, Executive or Dr. Spitters, if you would like to give some comments. If not, we can certainly, we certainly will be releasing more information as soon as possible.
Why don't we hold on just for a second and I'll get Jason back.
Hey, Dave.
Thank you all for your patience. I don't think we expected to get this call right at the end of the availability.
So it should have all the details.
All right, we'll be getting an official letter within the next 15 minutes and we'll have all the details, and so we'll be getting those out just as quickly as we get the letter. So that's the official news. Very happy.
Well, thank you all again for joining us. I know that was a bit of an exciting wrap up there, but as the executive said, it sounds like we'll have more details coming in the next 15 minutes, half hour or so. So please stay tuned. We will get you an update as soon as we can. With that, I'm going to go ahead and wrap up so that the executive and Dr. Spitters can turn their attention to the information that's coming on the application approvals. So thank you all again, and we will have more information for you soon.
Thank you all.
Thank you.
Thank you.